had to have a hysterectomy on the day I gave birth because I nearly died twice. I am officially infertile and will never be pregnant again.
I can't think of anything more traumatic than what this poor woman has been through. But first, I want to reassure you, this is a very rare outcome of a postpartum hemorrhage, also known as a PPH. But let's talk about what it actually is and how we do treat it. So firstly, what is it? Well, PPH is excessive bleeding after you give birth, whether that's by vaginal or by caesarean birth, but it's usually defined as losing more than 500 mils of blood if you have a vaginal birth, or more than a litre after a C-section. And it can happen right after delivery, a primary PPH, or even days later, a secondary PPH. So how do we treat it? Well, when it happens, we act fast. Doctors and midwives have a whole toolkit of interventions to treat PPH, including, firstly, uterine massage. You'll often notice someone jumps on and starts rubbing your tummy. That's to help your uterus contract and to stop the flow of blood. Next, we have medications like oxytocin, which can make the uterus contract more effectively, stopping the bleeding. Or we can give medications as well, like tranexamic acid, which helps your blood to clot. Another thing we usually do is we check for retained placenta, and that's because any leftover tissue bits of placenta can continue to cause bleeding because your uterus just can't contract. If those things haven't worked, you're still bleeding, in more severe cases you might get moved round to the operating theatre, and that's where we can put in something like a Bacri balloon, which puts pressure on the womb and stops the bleeding. Or we can put an extra big stitch all the way around the womb, known as a B-Lynch suture. As this woman mentioned, her doctors had tried everything because preventing a hysterectomy is always the goal of treating PPH. But in rare cases, despite all of our efforts, removing the uterus, so performing a life-saving hysterectomy, is the only option to save a life. So PPH is scary, but the good news is that with quick treatment, most of our cases are managed very well. So tell me if you've heard of postpartum hemorrhage before, or if you had to experience it, what was your experience?